Hi, I'm Tina and this is Teresa. For many years, I've been training and guiding women during pregnancy and after delivery. Pregnancy is a totally exciting time in which many things change in your body. Your body's center of gravity shifts forward due to the growing baby, your tissues become softer due to hormones, and many muscles become more inactive, which can lead to overuse and strain. I've put together a BLACKROLL fitness workout focusing on the back and shoulders. So grab the BLACKROLL and a multiband and join us for the workout. Let's warm up. Stand tall, stand shoulder width apart, toes pointing forward, knees slightly bent, straighten your sternum, and then start to turn your head to the right and to the left. When you feel a stretch in this position, stay in there for 2 to 3 seconds and then switch to the other side. Bring the head forward and down, chin towards the chest. Then slowly backwards. Repeat this movement, working in a pain-free manner, and keep breathing deeply. Rotate the thumbs outwards, keep the elbows extended, and begin to circle the shoulders backwards. Always keep in mind your posture. Stand tall and upright. Try to position the pelvis over your feet in the center. Place your hands on your shoulders and circle backwards with your elbows, making large circles. Go into a squat and come back up. Try to keep your knees pointing forward. Sit backwards. Extend your arms up and continue the movement in exactly the same way. Go deep into the squat and come back up. Extend your arms. If you like, you can come up onto your toes when you're at the top. Be aware of the load on your big toe, so that you don't tip over. Breathe. Get the circulation going. Here we already start working on stability. Place your hands on your hips and circle your pelvis. Move your hips forward, sideways and backwards, making big circles. Breathe deeply and lower your pulse again. Place both hands on your upper legs, go down into a squat and round your back. Then straighten it again. Try to move your spine freely and keep moving from cat to cow position. Try to keep pushing your sternum forward, chest open, and keep breathing. Roll back up, circle the shoulders back again. Before we start with the training, we will show you the first 3 exercises from our first block. It is best if you do them right away so that you know how to handle the band and the roller. Take the multiband, step into the band and stand shoulder width apart. Cross the band in front of your body and take one of the lowest loops in your hands. Extend the chest forward, bring the chin in, the back of the neck is long. And keep the knees slightly bent. Pull the band up and back. For the second exercise, take the roller. Again, stand shoulder width apart. The knees are slightly bent and tilt the upper body forward. Push the chest out. The shoulder blades slide back down. Come back to the starting position and repeat the exercise. Make sure that your spine is straight. For the third exercise, take the multi-band again. Step onto the band with the right foot. Step forward with your left foot. Then grab the last loop of the band. Straighten the toes forward. Tilt the upper body forward. And bring the arms up in front of you. Watch the abdominal tension. We start with our first block. We go back to the lowest loop of the band. Cross the band in front of your body and start the first exercise for 30 seconds. You can also combine the exercise with breathing. Pull the band backwards with the exhalation and go back down to the front with an inhalation. Keep your back straight and keep the chest open. And we go into the second exercise. Take the roller, take a shoulder width stance, and we start. Make sure the knees are only slightly bent. Find your own rhythm. Try to tense the glutes when you straighten the upper body. For the third exercise, grab the band again. Stand with your right foot on the band. The left leg is in front. And we start. Build up abdominal tension and push your arms up in front. Try to keep the band under slight tension at all times. Here you can also use your breathing. On an exhalation, push the arms diagonally upwards, and on an inhalation, take them back down again. We repeat each exercise. Stand shoulder width apart. Cross the band in front of you. We begin our first exercise. Build up abdominal tension. Thumbs point outwards. Hold the roller with the edges of your two pinky fingers. If you want more activation in your back muscles, try tilting your upper body a little lower. We take the band again and go into the last exercise. Take the left leg back and the right leg forward. Again, make sure you are straight out towards the front of your feet. Tilt your torso forward and again press your arms forward at an angle. Keep activating your pelvic floor. Build up your abdominal tension. Keep your gaze downwards and pay attention to your breathing. You have completed the first block. Put the multiband aside. Stand upright again and circle your shoulders back. Relax your shoulders and breathe deeply. Feel free to take your pulse between blocks. It should not be higher than 150 beats per minute. We go into our second block. Here we also show you all 3 exercises first. You can join in right away. We go into a quadruped stand with the roller under your shoulders and your knees under your hips. Tuck the toes under and start to bend and straighten your elbows. Try shifting your weight forward. For the second exercise, use the multiband again. Sit down. Place your feet in a shoulder width position. Again, cross the band in front of you. Grab into one of the lowest loops. Try to sit upright. Feel your sitting bones. Pull the band diagonally back. For the third exercise, sit down, take the feet forward, pull the tops of the feet upwards, and the hands are underneath the shoulders. Activate the abdominal and pelvic floor muscles. Then bring the pelvis up into a table position. Make sure you keep your gaze up and your chin at your chest. For the more advanced version, you can also use the BLACKROLL Made. Here you have more activation in your arm and shoulder muscles. Let's start with our second block. Take the roller and get onto all fours. Tuck the toes under. Activate your abdominal and pelvic floor muscles and start to bend and straighten your elbows. Try to bring the weight forward over the roller. And move at your own pace here. You're almost there. For the second exercise, use the multiband. If you want more resistance, just grab a loop further down. Sit up straight, and we begin. You're almost there. For the next exercise, place your hands behind you. Pull the toes up And we start. Go at your own pace. Try to maintain abdominal and pelvic floor tension. Return to the first exercise. Take your position and we start. Try to keep your elbows close to your body. Well done! We go into the second exercise. And we start. Pay attention to your breathing. Pull the band back on the exhale and release the tension with a deep inhalation. Smile, you're almost there. And we go into the last exercise of our second block. Take the position, activate your pelvic floor and abdominal muscles. Then push the pelvis up. Make sure you keep the glutes engaged. Come into a cross-legged position. Take a deep breath. Straighten yourself forward. And as you exhale, round all the way back. Again, go into your own breathing rhythm. Try to bring mobility into your spine. Let's move into our third block. Again, we will show you all three exercises before we begin. Grab your multiband. Go into the last loop with your right foot on all fours. Put moderate tension on the band and fix it with your right hand. Place your right hand under your shoulder and try to keep your back straight and lift diagonally your right leg and left arm. Make sure you straighten your left leg. If you want a more advanced variation, then bring the band up diagonally. For the second exercise, stand straight upright. Pull the band back towards your chest. The elbows may be slightly bent. Pay attention to deep breathing here as well. For the third exercise, stand on the band with a shoulder width stance. Go into a deep knee bend and grab with your hands into one of the last loops. Bend the knees and straighten your upper body. Take the multiband. Slip into the last loop with your right foot. Put some tension on the band again and fix it with your right hand. We start with the first exercise. Lift the right leg and the left arm diagonally. Bring it back to the starting position. Keep the spine completely straight. Switch sides. Make sure your elbows are slightly bent. Keep checking your right leg and keep it straight. Well done, you did it! We go into the second exercise. Stand upright. Bring the arms forward, elbows slightly bent, and start. Pull the band towards your chest. And breathe. You are doing something good for yourself and your baby. Second exercise is completed. Get into a shoulder width stance. Take one of the lowest loops. Extend the elbows. Knees are slightly bent. Straighten your back. Try to tighten the glutes as you straighten your upper body. Keep the basic tension of the pelvic floor and the abdominal muscles. Fix the band with your right hand. Then lift the right leg and left arm diagonally. If you start to get a little tired, you can also leave both hands on the mat and work with the right leg only. Once again, you should feel good during the exercise, and your pulse should not go over 150 beats a minute. Great! We switch to the other side. Align the knees under the hips again. The hands are under the shoulders. And we begin with the other side. Pay attention to the alignment of your right leg. And don't forget to breathe. Super! Come into a standing position. Stand shoulder width apart and bring the arms forward. Put a little tension on the band. The elbows are equally bent and pull the band back towards your chest. Try to activate the muscles between your shoulder blades. And breathe. We move into the last exercise of our third training block. Step into the band and grab one of the lowest loops. Build up pelvic floor and abdominal tension. Knees are equally bent. Straighten your upper body. Make sure your knees do not point inwards, but straight forward. You've almost done it. Perfect. Put the band to the side. Stand upright again. Circle your shoulders back and breathe deeply. I hope you feel good. Let's get into some mobility at the end of the workout. Take the roller. Sit backwards onto your heels and roll forward with the roller. Depending on how big your belly is already, take your knees further apart so that you have enough space for the belly. Push the roller far forward and try to bring the forehead low. Breathe. You can also stay down into this position. Breathe deeply. Get onto all fours. Take the black roll under your shoulders and make yourself completely round. Then move into the counter position. Do this movement as far as it feels good for you. Don't push yourself into any pain. Breathe deeply in and out again. For the next exercise, get into a sitting straddle position. Extend your right leg, bend your left leg. Perform a side bend to the right. Straighten the back again, breathe deeply and into your sides. Feel the stretch on your left flank. Try to stay seated with both sits bones connected to the floor. And stretch out one more time. Good. Let's switch to the other side. Come back to the cross-legged position. Circle the shoulders back again. Breathe deeply and feel into your body. Thank your baby. You've done great. I hope you feel good after this workout. You can repeat this workout 2 to 3 times a week. And remember, keep at it. If you want to know more about pelvic floor or pelvic leg strengthening, check out our other videos for prenatal training until then. We look forward to it.